Hello, I am Gerald Ababa Bisara from BSN 212K, and today I am going to perform an immediate newborn care return demonstration. All newborns require essential newborn care to minimize the risk of illness and maximize their growth and development. Prior to conduct of the procedure, I have performed hand washing to deter the spread of microorganisms that causes diseases and contamination, and I also have prepared the necessary equipments that I need, and these includes a weighing scale, a vitamin K eye ointment, gauze pad, thermometer, cord clipped, clamps, scissors, cotton balls soaked in alcohol, kidney basin, tape measure, baby's clothes it includes bonnets, mittens, and shirts, sterile gloves, alcohol, and lastly the drop light. Let's go and meet the client. Okay, so next thing to do is to properly identify the infant using a name tag or a wristband. Fernandez Joshua, age 1 day, sex male, date of birth August 31, 2023. Also, ensure the infant's comfort by making sure that the environment is warm. So, due to wetness after birth and lack of fat, newborns are at risk for hyperthermia. Infants in cold environment lose heat through conduction, convection, evaporation, and radiation. So now I am going to proceed by weighing the infant. So prior to this, I already have weighed the exact same port clamp that is attached to the newborn's umbilical cord, and I am going to deduct its weight from the total weight of the infant right here. So first, let us glove our hand because since we are touching the infant and we don't want to contaminate the infant. Okay, we're done gloving using the sterile gloves. Now, for a cord dressing, we need to put on the sterile gloves. But since that we need to weigh first the patient, we weigh first the infant and document the findings. Okay. Done. Now for cord dressing, we need to put our sterile gloves, and I put it now earlier, and properly restrain the upper and the lower extremities of the newborn. Okay. Now using the cotton ball soak and alcohol, disinfect the cord 3 times from the base upward. Okay. This is the cleansing solution. And discard it into our proper receptacle, which is the kidney basin. Now, place a sterile gauze pad at the base of the cord and clamp the cord with umbilical clip 1.5 inch from the base of the cord. So let us get our umbilical cord and discard this. Then clamp. Okay. Now, cut the cord about 0.5 centimeter about the cord clip and expresses the remaining blood from the cord with a gauze pad and place it on the base of the cord. Okay, then put it here. Okay, next, place the gauze pad base of the the cord stump and pour 70% alcohol over the cord. So let us get another gauze pad. So since that I don't have any um, alcohol solution, what is available is my alcohol spray, so I am using this. Now, I am going to proceed with the vitamin K injection. Vitamin K injections help the blood to flood, thus preventing serious bleeding, and it is very important to inject vitamin K to the newborn since the newborn does not get enough vitamin K from their mother during the pregnancy. And to do that, I am going to withdraw the exact amount of vitamin K from the ampule and inject it in the middle third lateralis of the baby. Discard. Done. And now I am going to proceed to getting the newborn anthropometric measurements, starting with the head circumference and measure it in centimeters. Next is the chest circumference or abdominal circumference. Lastly, the newborn's length. Okay, after that, I am going to measure the newborn's temperature rectally. Let's use our digital thermometer. So let's lift our baby's or the infant's buttocks to insert the thermometer. Let's wait for a minute. Okay, so the newborn is at 37 degrees Celsius, and don't forget to bring back the baby's position and also to disinfect the or to clean the thermometer. Okay, discard. Discard. Okay, so for the initial bath, hold the newborn in a foot grip manner and holding both ears. Carefully washes the newborn head with the use of baby soap or a mild shampoo and wipes dry the area. Then, okay. Now, after washing the baby, remove the wet gloves. Now, thoroughly dry the baby and put it on the newborn's shirt, mittens, and booties. Throw it into the proper receptacle. Dry the baby. Okay. Now, put it on here. Put the cup. So let's assume that this is a cup. of a baby because I don't have any. So let's improvise. Then the shirt. Then lastly, cover the baby. And after wrapping the baby like this, put it on the crib with a drop light on it because babies are so sensitive with the temperature. Now, the application of the CREDS prophylaxis shades the newborn eye from the light and open one eye at a time by exerting gentle pressure on the upper and lower lid. Now, apply ophthalmic ointment from the inner to outer canthus, making sure that the tip of the medicine tube will not touch the eye of the newborn. So I don't have any ointment, so let's assume that this is the ointment, so let's put it. Okay, now I am going to take the heart rate of the infant and respiration rate. Okay, for a minute. Okay, then the respiration rate. Okay. So after doing the procedure, we're now going to perform the after care of the equipment used and perform hand washing to avoid infection and contamination. Throw that into my proper receptacle here and do an aftercare. So now for the documentation of the procedure. Procedure done, I have included weight of the newborn is at 7.5 pounds. Heart rate is at 20 beats per minute. Respiration rate is at 30 beats per minute or 30 breaths per minute. Temperature is at 37 Celsius. Cancer circumference 17 centimeters. Chest circumference is 34 centimeters. Abdominal circumference is 26 centimeters and the length of the newborn is 43 centimeters. So I guess that's it, and that's the end of my return demonstration. Thank you so much.